Hello again, Dr. Karthik Gunasekaran from the Metromale Clinic, and this is the final part video on varicocele. So I've already spoken to you about what varicocele is and what are the types of varicocele, and I've already told you that varicocele can cause changes in seminal parameters and indirectly may be responsible for infertility. Now the bigger question is, when do you actually choose a person to be a candidate for varicocele surgery? Now when you subject a patient to a varicocele surgery, it is very important to actually realize that the couple is presenting you with infertility. They just came to you and said, "Doctor, I have varicocele," that is another thing. But if the husband has a varicocele, and he's got abnormal semen parameters and they are presenting with a long duration of infertility, then it makes sense to consider repairing a varicocele. The other important factor is the female partner has to be completely normal. She should not have any other problems, and there should be a change in seminal parameters. So these are very important factors that you should consider before you actually even take up the patient for a procedure. Now there are different methods of treating varicocele. And one of the most commonly employed methods is to operate on the patient with a varicocele. Now, laparoscopic techniques of treating a varicocele have been tried, but unfortunately, the results obtained from a varicocele treatment through laparoscopy have not been great. So this procedure has been given up. People tried an inguinal approach for the varicoceles, which means they opened up the inguinal canal, took out the veins, but this is very morbid, caused a lot of pain. So a lot of people have given up that also. So finally they decided, okay, what is the best technique? And they have narrowed down on this technique known as a subinguinal microscopic varicocelectomy, where the inguinal canal is not open. It is a very, very small incision, very small cut, and you just pick up the veins alone, and then you isolate them and you look under a microscope, and you can actually tie off the veins and you spare the testicular artery. So testicular artery should not be cut, so the blood supply to the testis remains intact. So this is the most commonly used and most preferred technique for repairing varicocele. Can you have side effects after varicocele surgery? Yes, you could have sometimes a hydrocele that develops because the lymphatics have been blocked. In a varicocele surgery, sometimes pain can come, sometimes infection can come, but albeit the risk of this complications occurring are very, very low. So how long do we actually wait after varicocele surgery to see the effects of a varicocele surgery? Well, we need to wait at least for 3 to 6 months. Now that is very, very important, because you know that the development of sperms, or rather spermatogenesis, takes about 3 months. So in order to see any significant change in the varicocele surgery actually helping the patient, we have to wait for at least 3 months. So I think I've pretty much covered everything that you need to know about varicoceles. And also one important other observation I would like to make is, in patients with complete azoospermia, that is no sperms, can we operate on people who have varicoceles? Varicoceles have not been shown to be completely associated with azoospermic patients, but the problem is sometimes some of these patients, very limited studies we have done, and we have found out that some of these patients do reverse, and there is sperm found in the semen of these patients. But also the important observation I'd like to make is that these patients actually go back to having no sperm after a prolonged period of about 6 to 9 months. So in case we do operate and find sperm, then this sperm has to be immediately banked or frozen, so that this can be used for an ICSI procedure later on. So I think that pretty much completes my talk on varicoceles. Thank you for watching, and if you have any doubt on the varicocele topic, about the type of varicoceles, whether you should go for a surgery and where the procedure is done, how to do the procedure, and what problems you might have, please feel free to write to me and I'll be happy to answer them for you. Thanks for watching.